Welcome back, deep divers. Ready for another fascinating journey into the human mind. This time, we're taking a deep dive into abnormal psychology.
Sounds intriguing.
It is,
Yeah.
but we're not just sticking to dry textbook definitions. We're going to explore how ideas about what's normal and abnormal have changed over time and across different cultures.
So we're looking at the big picture, huh?
Exactly. And I've been digging through some really interesting sources, everything from historical accounts to modern research papers, and even excerpts from the DSM-5, the diagnostic manual used today.
The DSM-5, that's the one mental health professionals use to define and classify mental disorders, right?
Yep, that's the one. And let me tell you, it's a lot more complex than I initially thought.
I bet. It's not always easy to draw a clear line between what's considered simply different and what actually meets the criteria for a diagnosis.
Right. Like, we all know that being a bit quirky doesn't automatically mean you have a mental illness. But where exactly is that line?
Well, that's one of the key challenges in the field of abnormal psychology. Unlike physical illnesses, you can't just do a blood test or take an X-ray to diagnose a mental disorder.
So it's more about subjective judgment.
To some extent, yes. It involves carefully assessing things like a person's distress, how well they're functioning in daily life, and whether their thoughts and behaviors are interfering with their ability to work, maintain relationships, or simply enjoy life.
So it's not just about whether a behavior is unusual. It's about the impact it has on the person's well-being.
Exactly. And what's considered abnormal can vary widely depending on things like age, gender, and especially cultural background. Something that might be seen as eccentric in one culture could be completely normal in another.
That makes a lot of sense. And I imagine that perspective has caused a lot of debate and controversy over the years, right?
Oh, absolutely. Defining abnormality is a bit like trying to hit a moving target. It's constantly being shaped by cultural norms and evolving scientific understanding.
Speaking of evolving understanding, I'm really excited to delve into the historical side of things. You mentioned earlier that we'd be traveling back in time to see how our ancestors viewed mental illness.
Oh, yeah. Get ready for some wild historical beliefs. We're talking ancient rituals, supernatural explanations, and some cures that would make your jaw drop.
Like tree panning. I was reading about that in one of the sources, drilling holes in people's skulls to release evil spirits. It just makes you wonder about the success rate of that treatment.
I wouldn't want to be the patient in that scenario, but what's fascinating is that even amidst those supernatural beliefs, you can find early hints of a more scientific approach emerging.
You mean like Hippocrates? He was the Greek physician who believed mental illness was a disease of the body, not a demonic possession, right?
Exactly. He attributed mental disorders to imbalances in bodily fluids, which we now know isn't quite accurate, but for his time, it was a revolutionary idea.
It's interesting to see how people, even back then, were grappling with the nature of the mind and trying to make sense of mental suffering.
Absolutely. And that quest for understanding has continued through the centuries, leading to some significant shifts in how we view and treat mental illness today. For instance, during the 18th and 19th centuries, there was a big movement toward moral treatment, which emphasized compassion and social interaction for people with mental disorders.
Right, I remember reading about that. It seemed like a positive step advocating for more humane care. But it wasn't without its problems, was it?
It was a mixed bag for sure. While it promoted a more compassionate approach, it also led to the creation of large, often overcrowded institutions.
Which, sadly, often ended up focusing more on containment than actual care. It's a reminder that progress isn't always linear. But jumping ahead to the 20th century, we see a surge in scientific advancements that really revolutionized our understanding of mental illness.
Oh, definitely. The development of effective medications, combined with breakthroughs in neuroscience and psychology, ushered in a whole new era of perspectives and treatments.
So let's dive into those modern perspectives. The source material outlines several different schools of thought, each with its own way of explaining the causes of abnormal behavior. They're each like looking at the same puzzle through a different lens, right?
That's a great way to put it. Each perspective offers a unique angle on understanding these complex issues.
Okay, well, let's start with the lens that seems to be the most dominant these days, the medical perspective.
All right, the medical perspective views mental disorders as illnesses. Much like physical diseases, they see them as having underlying biological causes. It really puts the focus on things like genetics, neurochemistry, and brain structure.
So if someone is dealing with depression, This perspective would look for imbalances in their brain chemicals, or maybe a family history of the condition.
Exactly. It's all about trying to pinpoint the biological mechanisms that might be contributing to the disorder. And while this perspective has led to some incredibly important breakthroughs, some people argue that it can be a bit too reductionist. Like, it focuses so much on biology that it neglects the role of psychological and social factors.
That's an interesting point. It's like saying a broken leg is only about the bone, not the fall that caused it in the first place, or the emotional stress that comes with recovery.
Precisely. And that's where some of the other perspectives come in, offering alternative ways to understand the complexity of abnormal behavior.
Okay, I'm all ears. Let's hear about some of these other perspectives and how they differ from that medical model. Where should we go next on our tour of the mind?
Okay, so we've talked about the medical perspective on abnormal behavior, which really emphasizes those biological factors. But I'm curious about those other lenses you mentioned. What are some other ways to understand why someone might develop a mental health issue?
Well, one perspective that really shook things up in the early 20th century was the psychoanalytic perspective. It was pioneered by, the one and only Sigmund Freud.
Yes, Freud. The id, ego, superego,
Yep.
and all those unconscious conflicts bubbling beneath the surface. Exactly. Freud believed that our early childhood experiences play a huge role in shaping our personalities and how we interact with the world, especially our relationships with our parents. And he placed a lot of emphasis on the power of the unconscious mind, those thoughts, feelings, and desires that we're not even aware of.
Oh, so according to this view, even experiences we've long forgotten could still influence our mental health today.
That's the idea. And while not all of Freud's theories have, completely stood the test of time, his work on early childhood and the unconscious has had a big impact on how we think about psychology today.
It's fascinating to think about how much our understanding of the brain has advanced since Freud's time. Have those advances influenced any other perspectives on abnormal behavior?
Definitely. Actually, the behavioral perspective kind of emerged as a reaction against the kind of abstract nature of psychoanalysis. Behaviorists, like B.F. Skinner, for example, argued that psychology should focus on observable behaviors, things we can actually see and measure, and how those behaviors are learned through conditioning and reinforcement.
So instead of digging into the unconscious, this perspective is all about what we can actually observe.
Exactly. One of the key principles of behaviorism is that we learn behaviors through association. So let's say someone develops a phobia, like a phobia of spiders. A behaviorist might say it's because they learn to associate spiders with fear or danger, maybe through a negative experience.
That makes sense. So it's not just about what's going on inside our heads, but also about how our environment shapes our actions.
Right. And speaking of what's going on inside our heads, that brings us to the cognitive perspective.
Which focuses on our thoughts.
You got it. Cognitive psychologists believe our thoughts, beliefs, and how we interpret events all play a crucial role in shaping our emotions and behaviors.
So, if someone constantly tells themselves they're a failure, that kind of negative thought pattern could actually contribute to them developing depression.
Exactly. Cognitive therapists work with people to help them identify and challenge those sorts of distorted thinking patterns, help them replace those thoughts with ones that are more balanced and realistic.
It's almost like retraining your brain to think differently.
Yeah, that's a great way to put it. And finally, we can't forget about the sociocultural perspective, which reminds us that mental health doesn't just exist in a vacuum.
It's about the bigger picture, right? How things like our social environment, cultural norms, and even our political systems can all impact our well-being.
Absolutely. This perspective really considers factors like poverty, discrimination, social isolation, even just access to resources, all those things as potential contributors to mental health issues.
It makes you realize that mental health isn't just about what's going on inside an individual. It's also about societal factors.
Exactly. If we want to create a truly mentally healthy society, addressing things like poverty and inequality is absolutely crucial.
So we've got all these different lenses for understanding abnormal behavior, each highlighting different parts of this big, complex puzzle. But how do these perspectives actually translate into, real-world treatment approaches?
Well, just like there are many different ways to understand mental health issues, there are also multiple ways to try to address them. The source material breaks it down into two main categories: biological treatments and psychological treatments.
Okay, let's start with biological treatments. What kind of interventions are we talking about?
The most common biological treatment is, of course, medication. There's a huge range of psychiatric medications out there these days, and each one targets specific neurotransmitters or areas of the brain that are involved in various mental health conditions.
So it's all about finding the right medication to fit the specific symptoms and, the underlying biological mechanisms.
Exactly. It's definitely not a one-size-fits-all approach. And, it's important to note that medications are often most effective when they're combined with therapy.
I've also heard of electroconvulsive therapy, or ECT. Is that something that's still used today?
It is, but it's not as common as it used to be. It's usually reserved for really severe cases of depression or other conditions that just haven't responded to other types of treatment.
And it's still a pretty controversial treatment, right?
Yeah, ECT definitely has a complicated history, and there are legitimate concerns about its potential side effects. But, for some people, it can be a life-saving treatment.
The source material also mentioned a newer treatment option called transcranial magnetic stimulation, or TMS. What can you tell me about that?
TMS is a non-invasive procedure. It uses magnetic pulses to stimulate certain areas of the brain. And it's showing a lot of promise for treating things like depression and anxiety, and it doesn't have those same side effects associated with ECT.
So our understanding of the brain, along with the technology we have, is constantly evolving, and that's leading to some really innovative new treatments. But what about psychological treatments? What are some of the key approaches there?
Well, we could probably talk for hours about all the different types of therapy out there, but the source material highlights a few main approaches. We've already touched on psychoanalysis, which, really delves into those unconscious conflicts and early childhood experiences.
Right. That's the classic image of someone lying on a couch talking about their dreams.
Right. That's the stereotype, but psychoanalysis has evolved a lot over the years. It's not as popular as it used to be, but it can be very helpful for people who really want to gain deep insight into their thoughts, feelings, and behaviors.
What about behavior therapy? I remember learning a bit about that in my Psych 101 class.
Behavior therapy is all about changing those learned responses and behaviors. It uses techniques like exposure therapy, desensitization, and reinforcement. It's often used to treat phobias, anxiety disorders, and even addictive behaviors.
So let's say someone has a fear of flying. A behavior therapist might slowly expose them to different things related to flying to help them gradually overcome their fear.
Exactly. Then there's cognitive therapy, which, as we mentioned, is about identifying and changing negative thought patterns. It's based on the idea that our thoughts really do influence our feelings and behaviors. So if we can change our thinking, we can change how we feel and act.
Like reframing those negative thoughts into more positive and realistic ones.
Exactly. And last but not least, there's interpersonal therapy, which focuses on helping people improve their relationships and their communication skills. It's often used to treat depression, anxiety, and, of course, relationship problems.
So it's all about recognizing how important our relationships are to our mental health, right?
Absolutely. Having those strong social connections and healthy communication skills can be incredibly protective when it comes to mental health.
Wow, it's amazing how many different approaches there are to treating mental health conditions. It seems like there's really no one-size-fits-all solution, and it's all about finding what works best for each individual.
That's definitely a key takeaway. And as we'll see in the next part of our deep dive, understanding all these different treatment approaches is really crucial when we start talking about specific disorders and how they're managed.
All right, so we've covered a lot of ground on the different ways to view and treat abnormal behavior, but now I'm ready to get a bit more specific. What are some of the most common mental health conditions that people actually face? And how do those different perspectives and treatments we talked about actually play out in real life?
Well, anxiety disorders are incredibly common these days. It's estimated that nearly a third of adults will experience an anxiety disorder at some point in their lives.
Wow, that's a lot of people. But I guess it makes sense though, right? Anxiety is a natural human emotion. We all experience it sometimes.
Oh, for sure. It's basically our brain's way of responding to perceived threats. And in a lot of situations, it's actually helpful. It keeps us alert and motivates us to take action. But when that anxiety becomes really excessive or persistent and it starts interfering with your daily life, well, that's when it might cross the line into a disorder.
So how do you tell the difference between normal everyday anxiety and an anxiety disorder?
A key factor is how much distress and impairment it's causing. Like if you're constantly worrying or feeling on edge, or you find yourself avoiding certain situations because of your anxiety, it might be a good time to talk to a mental health professional.
And there are different types of anxiety disorders too, right? You mentioned generalized anxiety disorder earlier.
Yeah, GAD is characterized by chronic, excessive worry about a whole bunch of different things: work, finances, health, relationships, you name it. People with GAD often feel like they just can't turn off their worries, even when they know, logically, that their worries are probably out of proportion.
I can imagine how exhausting that would be, just constantly worrying. What about panic disorder?
Panic disorder involves sudden, intense episodes of fear, which are known as panic attacks. And these attacks can seemingly come out of nowhere. And they often come with physical symptoms, like a racing heart, shortness of breath, dizziness, even chest pain.
Oh, wow, that sounds really terrifying. Are there any other common anxiety disorders we should talk about?
Well, phobias are pretty prevalent. Those are intense, irrational fears of specific objects or situations.
Like a fear of spiders or heights.
Exactly.
Yeah.
And while most people might feel a little uneasy around spiders or in high places, a phobia is a lot more intense than that. It can cause significant distress and lead people to avoid those triggers completely, even if it means disrupting their lives.
And there's obsessive compulsive disorder, or OCD. I've heard that one described as like having stuck thoughts and feeling like you have to do certain rituals over and over again to relieve anxiety.
That's a pretty good way to put it. Obsessions are those intrusive, unwanted thoughts that cause a lot of anxiety, and compulsions are those repetitive behaviors or mental acts that people feel driven to do to try to reduce that anxiety.
So someone might have an obsession with germs and then feel compelled to wash their hands constantly, even if their hands are like raw and chapped.
Exactly. And OCD can be incredibly debilitating, but fortunately there are effective treatments available. Cognitive behavioral therapy, in particular, has been shown to be really helpful for managing the symptoms.
Okay, so we've talked about anxiety disorders. What about mood disorders? Those seem like they would really have a huge impact on a person's life.
Oh, absolutely. Mood disorders affect how we feel and experience emotions, and they can have a big impact on things like our energy levels, our motivation, even our sleep, appetite, our overall outlook on life.
The two main types of mood disorders are depression and bipolar disorder, right?
That's right. Major depressive disorder, or unipolar depression, is characterized by persistent feelings of sadness, hopelessness, and just a general loss of interest in activities that you used to enjoy.
So it's more than just feeling down for a couple of days. It's like a prolonged period of low mood that really affects someone's ability to function.
Yeah, exactly. And it's important to differentiate major depressive disorder from bipolar disorder, which involves episodes of both depression and mania.
Mania being that state of really elevated energy and mood, and sometimes even risky behavior.
Precisely. People experiencing a manic episode often feel euphoric and have racing thoughts. They might engage in impulsive behaviors, need very little sleep, that sort of thing.
It sounds like bipolar disorder would be really challenging to manage with those extreme swings back and forth.
It can be. But with the proper treatment, which usually includes both medication and therapy, people with bipolar disorder can absolutely lead fulfilling lives.
So we've covered anxiety disorders and mood disorders. Are there any other major categories of mental illness that we should discuss?
Yes. The source material also mentions personality disorders. These involve long-standing, inflexible patterns of thinking, feeling, and behaving that are significantly different from what's considered normal in their culture, and they cause distress or impairment in different areas of their life.
So it's not just about having a few quirks. It's about personality traits that are so rigid and maladaptive that they really cause problems in relationships, work, other important areas of life.
Exactly. Personality disorders are often grouped into 3 clusters based on shared characteristics. Cluster A includes disorders like paranoid personality disorder and schizoid personality disorder. These are typically characterized by odd or eccentric behavior.
So someone with paranoid personality disorder might be super distrustful of others and always think people are trying to harm them.
That's right. They often have a really hard time forming close relationships because they misinterpret other people's actions as hostile or threatening, even if they're not.
Okay, what about cluster B? What kind of personality disorders are in that category?
Cluster B includes disorders like antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder. These tend to involve more dramatic, emotional, or erratic behaviors.
So let's say someone with borderline personality disorder might have really intense, unstable relationships, struggle with impulsivity, and be terrified of abandonment.
Yeah. And they might also engage in self-destructive behaviors and have a hard time regulating their emotions.
It sounds like navigating relationships with individuals with cluster B personality disorders could be pretty tough.
It definitely can be. Treatment often involves long-term therapy to help them learn healthier coping mechanisms and improve their interpersonal skills.
Okay, last but not least, what about cluster C? What are some of the defining features of those personality disorders?
Cluster C includes things like avoidant personality disorder, dependent personality disorder, and obsessive-compulsive personality disorder. And these are characterized by anxious or fearful behaviors.
So someone with avoidant personality disorder might be incredibly shy and avoid social situations out of fear of rejection or criticism.
Exactly. They might really crave connection, but their insecurities and inhibitions prevent them from actually pursuing it.
It's amazing how complex and varied mental health conditions can be. It really emphasizes the importance of getting an accurate diagnosis and a personalized treatment plan, doesn't it?
Absolutely. There's definitely no one-size-fits-all approach to mental health care. Each person's journey is unique, and their treatment needs to be tailored to their specific needs and circumstances.
Well, we've explored a wide spectrum of abnormal behavior today, from anxiety and mood disorders to personality disorders, and I feel like I've learned so much about how mental health challenges can show up and really how important it is to seek help if you're struggling.
And I hope our listeners have also gained a deeper understanding of just how complex mental health is and, the many different paths there are to healing and well-being.
I think you've done a fantastic job of explaining all of that. As we wrap up this deep dive, I'm left with a sense of hope. While the challenges are real, the field of mental health is constantly evolving. There's always new research and treatments and a deeper understanding emerging all the time.
I agree. And that brings us to a final thought-provoking question for our listeners to consider. Knowing what we now know about this interplay of biology, psychology, and social factors, how can we each contribute to creating a more mentally healthy world for everyone? It's a question worth pondering.
It really is. It's been a fascinating journey exploring the world of abnormal psychology with you today. And to all our deep divers out there, remember there's always more to discover. Thanks for joining us.